PVD, or the peripheral vascular disease, part 1. Age, gender, limbs, uni or bilateral involvement, onset of symptoms, pain, and characteristics of pain will be discussed in the part 1 video. So PVD, age, classically the PVD occurs in the old people. So in old age, it is due to atherosclerosis, but sometimes it occurs in atypical age groups such as young or middle age. Young people, say 20 to 40 years, it is mainly due to tau, which is thromboangiitis obliterans, otherwise called the Buerger's disease. And in the middle age, it's mainly because of diabetic vasculopathy, or arteriopathy to be precise. Gender, usually male are affected because male people smoke a lot, and females sometimes atypically, so it's due to Raynaud phenomenon. And the limbs affected, mainly the lower limbs are affected in atherosclerosis and Buerger's disease, whereas upper limbs are affected in Raynaud's, and cervical ribs, Callineus anterior, and Morvan's syndrome are the differential diagnosis for it. And Morvan syndrome is nothing but syringomyelia along with white vitiligo, painless vitiligo, syringomyelia. That is Morvan syndrome. Unilateral or bilateral involvement, everything is bilateral. Everything is bilateral except for embolism, which is unilateral. So I've written the Raynaud phenomenon and Buerger's are always bilateral, but atherosclerosis and diabetics, it will start by being unilateral and finally becomes bilateral. Onset of everything is gradual except emboli, which is sudden, and all those other things. The diabetic alone is due to a trivial trauma which goes unnoticed often, and pain is due to intermittent claudication. There's Buerger's disease, and rest pain, ischemic changes in the somatic nerves. So yes, about Buerger's disease, there's this picture. At various levels, there will be occlusion of the arteries. So the first picture says, okay, so in the lowermost part, there is pain in the foot, which is due to lobotibial or plantar artery occlusion. And above the femoropopliteal junction, if there is occlusion of the artery there, then calf will pain. And superficial femoral artery is occluded near the ring, then the thigh hurts. And the bifurcation of the common iliac artery, or if the aorta is occluded, then the buttocks will hurt. About the rest pain, about claudication pain, one more thing is that, so the person is fine and he starts walking, and after some time there is pain. It's because of buildup of the substance P, or the pain substance. And the time with which he can walk, up to which he can walk without any pain, and that's called claudication time. And during which the substance P is going to become high, and constantly if he keeps walking, it might get washed away because of very good blood supply, and pain disappears. But mostly the pain occurring after the claudication time will be very severe, necessitating him to sit down and take a rest. And about the rest pain will relieve on putting the limb. Usually it's the lower limbs which are affected, so it relieves by putting the limb below the level of the heart. But if it's rest pain and we put the limb above the level of the heart, then it will exaggerate the pain instead. Thanks.